Hello and welcome to our spontaneous little update on pertussis. Thank you all for joining us today. And this is a special webinar. We don't have contact CEUs for this, but we are just doing this to update the school health people on pertussis before we leave for winter break. This was an idea that was thought of by a school nurse. So we assembled a wonderful panel for you today. I'm Andrea Riley. I work for Children's Nebraska as a school health liaison, and I'll be moderating this panel today. And I'm going to go ahead and call on our panelists and have them introduce themselves really quick before we get started. So I'm going to pass it to Sarah from West Central. Would you like to introduce yourself a little bit?
Hey everyone, my name is Sarah Ningen and I work for West Central District Health Department. I'm the Director of Community Health here and have been here for about 5 years. In my current role, I work closely with our area schools with doing their absenteeism surveillance, or if there is something that pops up like pertussis, I will be your contact with our area schools to kind of help you through that situation and also be a contact between you and the state or whoever else needs to be in the know. So that is me.
All right, thank you, Sarah. Next, I have Carrie Neiman.
Hi there, I'm Dr. Neiman. I am an adult in pediatric infectious disease doc, and then I also serve as medical advisor of the Douglas County Health Department. Nice to meet you.
Thank you. And Juan Turan.
Sure. My name is Juan Turan. I'm an adult infectious disease doctor. I practice at the University of Nebraska Medical Center, but I'm also the medical director for Nebraska ICAP. So we provide infection control support to the state in different settings, including schools.
Great, thank you. And Allison?
Hi, I'm Allison. I'm the vaccine preventable disease epidemiologist here at the state. So I analyze data and do vaccine preventable disease surveillance, and then also support the local health departments when they're investigating cases of vaccine preventable diseases.
All right, and then we have Chris Kashat.
Hello, I am Chris Kashat. I am a nurse that specializes in infection prevention, and I work with Dr. Turan for Nebraska ICAP, and I'm the lead for the school program.
All right, thanks everybody. We have one more person who's also with us today. Dr. Alisada, would you like to introduce yourself? Since you're here.
I'm Alisado. I'm in pediatric infectious disease. I'm just here as backup.
Well, thank you for being here. So I'm going to start out with Dr. Neiman, and she is going to just give us a basic introduction on pertussis.
All right, I'm going to share my slides. All right, does that look good?
Yep, that looks great. Thank you.
Wonderful. So yeah, I'm just going to do a quick overview of pertussis, also known as whooping cough. All right, so pertussis is an infection by a bacteria called Bordetella pertussis, which is a small aerobic gram-negative rod, which is a beautiful picture here on your right. And it likes to attach to the cilia of our upper respiratory tract. It releases a toxin, and then that damages that cilia, and it causes the airways to swell, and that's where we start to get our symptoms. I think this is a really nice picture of that. You can see here on the circle in the middle, we've got nice healthy cilia that all look like they're kind of going in the same direction. And now on the right, they've been damaged by that toxin. It's all disorganized, and it's got this thick mucus there that's just not allowing good airway clearance. So pertussis is kind of interesting. Humans are the only known host. We can see it year round, but it does tend to peak in summer, autumn, and we're definitely seeing it all autumn. Transmission is person to person through large respiratory droplets. We know that it's really contagious if you are not immune to it. So 80% of susceptible household contacts will get infected if they are around someone who has pertussis. And then our incubation period is anywhere from 5 to 21 days. And you'll see that 21 days a lot. And when we think about kind of when to give post-exposure prophylaxis and how long to stay out of school if you don't get treated. So our clinical manifestations, it's divided into kind of 3 different stages. So stage 1 is the catarrhal stage. And this is usually when you've got early symptoms for maybe the first 1 to 2 weeks of the illness and kind of upper respiratory symptoms. We've got a runny nose, we're stuffy, maybe that low-grade fever, I'm getting sick, but we're contagious during this period. Babies, though, are very unique in that they generally will have an atypical presentation. This stage can be short, but as it kind of ends, they start getting, they can have gagging, gasping, bradycardia, or apnea. And that's what we really get worried about is when these babies start having apnea, which then leads to cyanosis and all sorts of problems. Our second stage is the paroxysmal stage. And this can last anywhere from 1 to 6 weeks, but up to 10 weeks. And we talk about this as being the 100-day cough. And this is the period where we get that inspiratory whoop that we really know about. You get those coughing fits that come at burst, more so at nighttime. Coughing so hard that you're throwing up, even fracturing a rib. In between the coughing fits, people may seem fairly well, but they do come in these bursts. And you are contagious still till about 3 weeks after that second stage starts. And then we finally get to that stage 3 or the convalescent stage. It's sort of the last 1 to 3 weeks of the illness where your symptoms are gradually improving. But during this period, you're still more susceptible to other infections. So you may get a secondary infection during this time because that cilia still isn't working. We're not getting that adequate airway clearance. This is just a nice way to put all those stages in one graph. But you can see here we've got the incubation period, kind of that 5 to 21 days. That first stage, that's 1 to 2 weeks. The paroxysmal stage, that's 1 to 6 weeks. And then that convalescent stage. But really, this is a very prolonged illness. Complications can be many. We talked a little bit about babies already, but 1 in 3 babies, if they're less than a year old, they're going to require hospitalization. That's an enormous amount. If they're hospitalized, 2 in 3 babies are going to have this apnea. And as you can see the baby here on the right, when this happens, often we will have to intubate these babies and support them. They can get secondary pneumonia, they can have seizures, encephalopathy, and some develop even pulmonary hypertension. And about 1 in 100 babies will die from complications of pertussis. For children and adults, not as severe complications, but still many complications. They can get that secondary bacterial pneumonia, syncope. This poor child on the right is coughing so much that they've got these conjunctival hemorrhages. Incontinence, as you can imagine, with all this coughing, weight loss, not sleeping well for any parent. 100 days of cough is going to be a sleep disturbance. Hernias from developing from coughing so much, and then even cardiac dissection has been reported. So if you think that a child has pertussis, what do we do? Well, we should be testing them. Culture is probably the gold standard, but really these days we do nasopharyngeal swabs for PCR. And you could either do kind of a full respiratory pathogen panel if you're not quite sure that this pertussis, but if you're really concerned about pertussis, you can even do a dedicated just pertussis PCR. Now, the full respiratory pathogen panel, is several $100s, a little bit cheaper when we're doing that isolated PCR. Treatment. We would ideally like to start treatment within the first 1 to 2 weeks. That's going to be the most effective at reducing symptom severity and then decreasing that period of where they're contagious. Because remember, they're going to be contagious for several weeks. And then we would even consider treating prior to the results if that clinical history is, strongly suggestive of pertussis. If they're at high risk for severe or complicated disease, or if they're around people that are at high risk for having severe disease. And what do we treat them with? And so the main go-to is probably azithromycin because it's the easiest, once a day for 5 days. But there's other options available too, other macrolides and then Bactrim, but the duration does increase with those. Timing of treatment. So if you are more than a year of age, we would like to get that treatment started within 3 weeks of the onset of cough. If you're less than a year, we'll go up to 6 weeks after, or if you're pregnant within 6 weeks of that cough inset. We really want to get those at highest risk treated. For post-exposure prophylaxis, we'll recommend that within that 3 weeks of exposure, and that's really tied to that incubation period, that 5 to 21 days. So who needs post-exposure prophylaxis? So all household contacts of a pertussis case. We know that even if they're vaccinated, they're at increased risk. And then those individuals that are at high risk of developing severe pertussis. And again, those infants, those babies less than 12 months of age, that's who we really need to protect. Anyone with pre-existing health conditions, immunocompromising conditions, moderate to severe asthma, all those patients are going to have increased chance of having adverse outcomes with this infection. And then we need to remember that it's not just those people, it's who they may be in contact with. And so if you are an individual that's been exposed, but you're going to go home and there's a baby in the household, then yeah, you should get post-exposure prophylaxis. If you're going to be around other people, if you work in a nursing home, if you work in a school, maybe consider getting post-exposure prophylaxis. How do we prevent pertussis? Well, we vaccinate and we vaccinate. And so to follow CDC guidelines, children get their primary DTaP series at 2, 4, and 6 months. We then give them a booster at 15 to 18 months, and then at 4 to 6 years old when they're going into a kindergarten. Then we switch to Tdap at 11 to 12 years. And then pregnancy, every time someone is pregnant, they should be getting a Tdap during pregnancy to protect that baby during those first few months of life. Parents and siblings of infants, they should get an extra booster at that time. And then every 10 years, you're supposed to be getting your TD or Tdap. And I would say get a Tdap, don't get a TD, because why not get pertussis extra protection? This just is a nice overview again of when and who should be getting vaccination for whooping cough. And it shows, from the baby to the very elderly, so everyone. So thinking specifically about a school setting, so students or staff with pertussis, they should be excluded from school until completion of 5 days of a recommended antibiotic course. And then if they elect to not be treated, not to do the antibiotics, then they should be home until 21 days after their symptom onset, after they are no longer contagious. If you have an exposed student or staff, when those positive tests come through, the local health department should be notified. They'll do their contact tracing, and they should be sending out a letter to all those people that have been exposed. If they are at high risk or have that contact with a high-risk individual, then they should consider having post-exposure prophylaxis. If they are unimmunized or under-immunized, they could also just go in and get the vaccine, a booster. That would be ideal as well. And occasionally, if there are multiple cases within a classroom or a team, the health department may just recommend that everyone in that room get post-exposure prophylaxis just so that we can halt the spread of transmission. So at Douglas County, I know we've done that in a few instances this fall when there's been 3 or 4 kids in the same classroom that have been infected, and we're going to recommend post-exposure prophylaxis for all those kids just to stop that further transmission. And that is pertussis in a nutshell.
Great, thank you so much. What I'm going to do now is just ask the panelists a few questions, and then we're going to have time for your questions from the audience at the end. So first question for everybody is, right now, what are we seeing in Nebraska? And this is open to any of the panelists that want to take this.
I have some slides with numbers to show. Let me share. Okay, so since January, we have had 379 cases of pertussis. We've had 8 cases hospitalized, and 5 of those are under 1. And again, we want to pay attention to those under 1s because they're susceptible to severe outcomes with pertussis. And the table below shows an age breakdown, and you can see that 75% of our cases right now are between the ages of 7 and 19. So it's a lot of your school age kids, college, getting into college age kids. And this graph shows the number of pertussis cases per 100,000 people by age group and year. And so you can see traditionally the less than 1-year-olds have had the highest rate. That has changed this year. The 11 to 19-year-olds have the highest rate, which is unsurprising because that's where the majority of our cases are right now. And then of course you can see the impact of COVID, people social distancing, people masking. We really did not see any pertussis, or very, very little. And certainly we did not see outbreaks like in schools for the most part. Oop. And this graph shows the number of pertussis cases by cough onset month. So you can see we really started picking up in September. And of course, that's when kids go back to school. And so it really started to shoot up, you know, September, October, November, and then December, that number, obviously since December 1st through what Saturday, I think is what data I have. And then this comes from our school immunization survey. So it looks at immunization rates for various vaccines that you can see on the right here in the legend at 2 different time points at school entry. So that's like kindergarten or 1st grade, and then at 7th grade. And the blue line is the pertussis, so the DTaP, Tdap, and also TD. And for kindergarten, the coverage at school entry for 2023-2024 school year was about the same as the 2023 school year, and coverage is just above that 95% rate. And we're getting soon, we should have data for this year's survey, and we'll be analyzing that soonish, hopefully. And then this is 7th grade. So again, 7th grade, the vaccination rates for that Tdap were roughly the same in the 2022-23 school year and the 2023-2024 school year. But the coverage rates have dropped below 95%, which is concerning. And overall, like when you consider all of these vaccines together, the last few years, our overall vaccination rates have gone down. So we're really trying to keep an eye on that and make sure that it doesn't continue to go down, and that kids continue to maintain, you know, their school vaccines. And I think that's all I have. Yeah.
All right. Before I open up to other panelists, does anybody have any questions on those slides? Because that was a lot of good information you shared. If so, you can put your question into the chat. And you know what, I'll just go ahead and open it up to the rest of the panel. If anybody just wants to chime in with any observations of what's going on in Nebraska right now, or what they're seeing in their clinic or health department or their little corner of the world. All right, I'll go ahead with the next question then. What are the recommendations for schools and school nurses? And this is open to any panelist that wants to jump in here.
I can jump in just a little bit here. So one thing I wanted to mention that is of high importance is being within the school system. Part of your job would be monitoring vaccine status and making sure our kiddos have all of the recommended or required vaccines for entering school. And we all know that there might be some individuals that it's hard to make sure that they're getting those vaccines, and pertussis is one of them that's required. So just providing just a little bit of education for parents might be of benefit, whether that's sending home a flyer or something about pertussis and why it's important that we are treating our kiddos with that, or giving them their vaccine for that might be of benefit. I always like to suggest that, and teaching your kids about proper hand hygiene and covering their cough and sneeze for this time of the year is important for a lot of different things, including pertussis. So adding that into your teaching of your kiddos is a good idea as well.
Thanks, and I love that. Absolutely right. We should use this, time to drive home the point. This is why we are vaccinating kids, because we do have outbreaks of vaccine preventable diseases like this. So now's a good time. So thank you. I'll move
Also,
on to
what
Chris.
Sarah
Oh, go ahead.
mentioned about education to the parents, not forgetting that many of the parents may not speak English. So it's a good time to make sure that you provide education pamphlets that are also in Spanish, Haitian Creole, and Chris did a great job in compiling some of that education. Some of them are from different health departments, and we will provide those links too, so you can distribute that. And also go into the basics, make sure that you have adequate hand hygiene in the classroom, working with environmental cleaning, making sure that those frequently touched surfaces are being cleaned, promote indoor air quality. So, if your classroom has some space to separate the kids and you can increase ventilation, or maybe you have an air purifier with a HEPA filter, that's also going to be great. The better indoor air quality you have, the less risk, not only for whooping cough, but also other respiratory viruses. Now that we are in the winter season, and we might see more influenza, COVID, RSV. So, the things that you do for pertussis is also going to help for the other viruses and bacteria.
Great suggestions. Chris, did you have anything else to add off of that?
It's interesting. We just got done with a poster that we created for respiratory prevention. And what Dr. Turan just talked about, the CDC had put education out for the different layers of protection, respiratory etiquette, hand hygiene, preventing airborne transmission, and the different things you can do, plus the cleaning and disinfection, just wiping down those high touch surfaces. Pertussis is droplet. So it's not really airborne at all, but that droplet, so that respiratory etiquette, as Sarah had mentioned, is very important. Having plenty of tissues, making sure they're performing hand hygiene, having that alcohol-based hand rub available. It's an excellent for hands. It's less drying than washing. And soap and water is a little bit harder to get to. So it's easier to have alcohol-based hand rub available for kids if possible. But tissues, if you could get them to throw it in the trash, that's even better. We know how they do, but there's 7 layers. We have a poster. I'm going to put the link in there that just came out. You can pull it off our website as a download and print it out for free. But the aim for that is to educate kids about these different things that they can do. Social distancing, give yourself some space between people. You don't have to sit right on top of each other. What else am I missing? Anything else on that? You look at it so many times, I should have it memorized, but.
And you might be able to share the screen on the poster, just to walk them through the 7 layers of I think it's a great resource, and if anybody has any interest, we can talk with local health departments, see if we can distribute that poster. So we can work with you to make it available.
Yeah, Chris, would you like to share your screen? Oh, you got it. Thank you.
You got it? Now if I can make it smaller so you can see the whole thing. And we have the website, so on the bottom, down here. It talks about ventilation, which Dr. Turan had talked about. cleaning, sanitizing, and disinfecting, which really kids can't do a whole lot, but it does talk about cleaning their backpacks and wiping those down, things that they can do, the hand hygiene, masking, you know, if you've got a cough. I know people don't like to mention that word, and we do stay away from it, but the sick individual, that mask, a good fitting mask works like a filter to keep them from, you know, spreading that virus. The physical distancing, respiratory etiquette, and of course, vaccines. So yeah, this is the poster. The goal was to educate kids. Kids educate parents. We only have it in the English version at this time.
All right, and you put the link to that in the chat.
Okay, and I think I just did, so
Yeah, thank you very much.
hopefully that works.
Yeah, absolutely. I'm gonna pass it
Just
to,
interesting, 20 minutes ago, my daughter just texted me that she got a notice from the school that her 11-year-old son was exposed to pertussis, or has a student in their class, and wanted to know what to do because their daughter, who's not in his class, if she needed to call the doctor about her. So it's getting out there, you know, and told her, says, well, you don't have to call if the person has been exposed to somebody who's been exposed to somebody. It's only if he gets sick, but.
gotcha, okay. Dr. Neiman, do you have any other recommendations for schools or school nurses?
I was just going to say, I think there have been hundreds of those letters sent out to children across Nebraska this year about being exposed. No, I think, you know, we just kind of go back to the basics, and I think this was driven hard to us in the pandemic of what to do to try to prevent infection. And we did it very well because we could look at the graph for what happened for 2 years. So just kind of going back and maintaining those things that we know work well.
Awesome, thank you. All right, well, my next question is, does anybody else have any, we talked about this a little bit, but does anybody else have any additional resources for parents or families that they, you know, want to highlight for school nurses or school staff? I just want to thank Chris and Dr. Turan, because we had talked a lot before this about like how to best serve our families in Nebraska that speak different languages. And so they did a great job of vetting and finding some information. So make sure that you know that there's some wonderful Spanish infographics here in the chat. And if there's other languages, just, you know, let us know too. But we definitely want to make sure that we are doing our best to communicate to all of our families when there's pertussis going around. Is there anybody else that has any other resources that they want to share or highlight?
I would
You
just encourage everyone to, you know, even contact your primary care provider, your pediatrician, and get that advice directly. I know that the letters coming out from the health department are pretty detailed in their recommendations, but it's always good to get, you know, what my pediatrician thinks is best for my child. And they're always wanting to take those calls.
Good advice. Absolutely. Thank you.
I was going to remind them of the nice book, because you guys have a beautiful section in there about pertussis with all the signs and symptoms, what to do, and some links that has that information. All the schools got at least one hard copy of that, and it's on the internet also.
Yeah, actually, why don't I just
Grab that for you real quick and put it in there too.
Yeah, if you could put in the link, I'm going to share my screen a second and just put that in here. All right, so this is a nice book, and this is our page about pertussis, with what schools should be doing, and know if there's that little phone icon, that means this is something that is reportable to the local health department. And then just a graphic on disease prevention. And of course, there's a great page on the CDC and then on AEPhealthychildren.org. I want to highlight that for a second here. It's just a very good page with a video here. But then if you click on that, then the whole thing is translated into Spanish. And then there is a nice video that's in Spanish as well, in case you have some Spanish speaking parents that you would like to share that with. So that's linked off the nice book.
FYI, the CDC link is broken like so many CDC links. So one of the QR codes is not good. The CDC changed their website and broke a lot of the links, unfortunately.
Yeah, after
But
we
it
published
does
the nice book,
connect
they
to
decided
the
to change their
healthy
links.
children. So Andrea, there is a question in the chat. Sherry, this is probably for one of you physicians there. At what point are kids that are not immunized excluded from school?
Yeah, great question. I will hand it off to whoever wants to take that.
Well, we can't exclude them from school unless they have infection. And so, well, once they are infected, they have to be out for either those 5 days until they've got 5 days of antibiotics on board, or until 21 days after symptom onset. I don't think there's any other guidance on not allowing them to come to school.
And regardless of vaccination status, you know, we want potentially exposed kids to symptom watch for 21 days from the last time that infected student was in school. And we really want parents, if they have symptoms, to immediately isolate and call their pediatrician to have their child evaluated. You know, we don't want kids going to school with, you know, cough, fever, because it could be pertussis this time of year. It could be a whole lot of things. You know, it could be a whole lot of things, and none of those things we want in our schools. And so, you know, any kid that's coughing, we want to stay home regardless of immunization status. Yeah.
I'm seeing another question or comment in the chat as well. So kind of and maybe someone else wants to also answer this, but they're talking about how they have some suspected cases that are just clinically diagnosed and aren't tested, and just want to make sure to voice the importance of making sure that individuals who are actively ill, just like Allison was saying, or coughing, that they are staying home. And that should really be the case with if there's any illness happening with a child, just staying home when you're sick. And, you know, making sure the school is going to be okay with that. But I would, and I don't know, Serena, where you're located, but if it were in my jurisdiction, then what I would do is I would probably reach out to the provider as a health department and just ask maybe if we could look into really testing some of those individuals, because that would be some really important information to know if it is indeed pertussis, and you know what they're basing their diagnostics off of, I guess, is what I would want to know. I don't know if anyone else wants to add to that.
Sure. So just for the sake of the recording, the question is, I have several suspected cases in my small school. They're not test confirmed, but are clinically diagnosed. The local doctors are not testing for it, but just treating the individual and not necessarily the household members. Some are and some aren't. We are not getting notified from the health department because they're not testing. I have called and consulted with the health department. My question is, how do we get the providers to test so we know how to treat our schools and students?
I think that's a really tough question. As I alluded to before, the testing of this can be expensive and oftentimes is on the, goes to the parents with, a couple $100 to several $100 to run the full respiratory viral panel. In addition to pertussis, right now we have a lot of mycoplasma and atypical pneumonias, and the therapy is the same. And so when you're discussing that with a family, the result of the test may not impact what I'm going to do. And so do I put that cost on the family? I agree that it should be done, but I kind of understand where they may be coming from.
And maybe in the meantime, making sure as a school is to follow, making sure we're cleaning the surfaces really well. And if we can, socially distance at all in the meantime, while we're either waiting for testing or just hopefully people are going to start getting better. And just educating parents and children on, the proper hygiene and coughing, sneezing etiquette and etc. All of those types of things.
Yeah, and I like the idea of just having the health department contact those providers and say, hey, there's a reason why we need to know who needs post-exposure prophylaxis and who needs to be symptom monitoring in our schools, and have that in their back pocket when they're talking to parents.
Great. Another question is there a difference in symptomatology with vaccinated versus unvaccinated students? I wondered that same thing too. If nobody else was going to ask, I was going to ask that. So thanks, Katie Anderson.
Yeah, I think vaccine will augment the course for you. You may not have as a symptomatic disease as if you were unvaccinated. But as with everything, as we saw, even with COVID, that can be variable.
So is the treatment then the same, whether or not they're vaccinated or unvaccinated then?
No, it's the same.
Okay.
And actually, I just recently, sorry, not trying to steal all the talking here, just had a couple cases in the same family. One was vaccinated, one was not. And definitely more severe symptoms in the unvaccinated individuals. And actually the one that was current with vaccination was asymptomatic and didn't realize that they had pertussis at all until the one with symptoms was tested.
All right, great question. All right, school nurses, any other questions that you want to shout out or put into the chat? Oh yes, I will email you the link for this session and probably put it on the website. Thank you, Linda Munderlow, who was actually Linda Munderlow. I just want to say thank you for the suggestion. She's from Bancroft Rosalie and ESU2, and it was her idea to get us all together. So thanks, Linda.
So a quick question, do you see asymptomatic spread? Because if they're not coughing, right, they're probably not spreading it.
I don't know if I can comment on that.
Or just less likely to spread it. I mean,
Probably less likely to spread it, but probably still able to.
I would think if you had mild symptoms, the problem is the first part of the disease where they are plenty contagious looks like everything else. Because
yeah,
it's just
they
kind of a
probably just
runny
very
nose.
mild symptoms.
So there's not, you don't immediately think, oh, this kid might have pertussis, because they have very generic mild symptoms until they don't, right? So that's hard.
I had the same question with my specific cases, the asymptomatic and then the symptomatic. It's you don't know who was sick first, and so who passed it to who? I don't know. So that is interesting. Yeah.
More snot and more coughing is probably spreading more, but it doesn't mean you couldn't, in theory, spread.
All right, are there any other questions for the panel here? Or panelists, is there anything else you forgot to mention?
I guess all of this is Allison. I'll just mention, if you don't have a relationship with your local health department, call them up and get to know them because they are a fantastic resource for your community. And, they can help you with letters. They can even hook you up with our lovely ICAP team. Help you with some infection control stuff. So, and an outbreak is not when you want to start forming those relationships. You want to have those relationships ahead of time. So I definitely encourage you, if you don't already know your surveillance, epi people at your health department, give them a call and get to know them. They're very nice people. I work with them every day. I can tell you that. So I'll just put a plug in. Yep, that's my plug for our local health department. So
Good advice. Good advice. Thank you so much. I actually have a question for the school nurses. What kind of resources do you need? Like, is there anything that we need to create, like, sample letters or, posters or anything? what can we do to respond or to make your job easier in school? If you have any ideas, just put them in the chat, or else you can always think about it and let me know through email. I'm going to put my email address in the chat here too. But is there anything that you're missing that the people in this, on this Zoom call can provide for you? The nice book is a great resource. Thank you.
I would love, your PowerPoint will be great just to reference back to, but also sample letters is always a great help of what communication, giving us guidelines. I'm an administrator in Bellevue Public Schools, and I can tell you when those cases come up, you're right. The health department is a wonderful resource, people that we tap into all the time, but having that, and for the nurses, and just making sure we refresh our guidance, because it doesn't happen very often. And I'm also the English language coordinator. Thank you so much for providing things in other languages. I've already downloaded and be able to share that out.
Yes, absolutely. And so, yeah, the local health departments do, have written letters for schools, and Beth Ramel just commented our local health department has created a very good letter. Yeah, we can maybe talk about that if we, if there's anything else that we would like to put on our school health website or something like that. And then, oh yeah, Chris Kashat had a great point. I almost forgot about that, Chris. Thank you so much for putting that in the chat. And that's that we did a Kids Health Zone newsletter on Pertussis last month from ICAP. And so go ahead and click on that link and download that. That's a very good resource too. Maybe I should put that on my website as well. And Sarah Bird says maybe a good poster that can go into the video slide that shows that play and repeat in the school cafeterias would be nice. That's a great idea. Yeah, we can do something like that. Not a problem. Cool. Keep those ideas coming. Thank you. And thank you, Sue, for speaking up there. We can help you with that. Is there any school nurse that wants to share how Pertussis is affecting their district or their school? And if not, that is okay too. Okay, so here's something else. Parents and staff want to know why we are seeing whooping cough. That information simplified would be great. I like that. Right now, while we're all on, does anybody want to talk about that real quick? About why we're seeing whooping cough right now?
Dr. Sato, do you want to talk about the vaccine?
That to that school nurses can simply, communicate to parents in kind of an easy way. Yeah, go ahead, Dr. Sato.
It's just a tiny bit complicated. So there used to be an old vaccine that people might have been scared of, which was in DTP. So that was a whole cell. They just took the whole bacteria, mushed it up, and that was used as the vaccine. The little A in the current vaccines is acellular. So it's only a couple things in there. There's only 4 antigens, and 2 of them are doing most of the heavy lifting in the current vaccine. So it has fewer side effects, and people got scared because babies would get these shots and they would get very high fevers, and babies with high fevers can have febrile seizures. And so people were very disturbed, and there was a concern for encephalopathy from the old vaccine. So the vaccine was improved to make it only have a couple things in it, and so it doesn't cause as many problems as it used to. The problem then is that because it only has a couple 2 things in it that really give you a long-lasting antibody protection. Some of the bacteria have lost one of those 2 things, like a lot of the bacteria have. So you really have only one thing in there trying to provide the vaccine activity for the long term. So basically the protection from the vaccine doesn't last as long, especially with strains that have mutated away from what's in the vaccine. And so if people overall are getting fewer vaccines, which is also true, then there are just more people out there who are at risk to get infected when it comes around. And because it transmits very easily, it's very easy for me to infect a whole bunch of people if I get it. The combination of fewer people still being well protected by vaccine or ever getting vaccinated and this infection, and the infection itself doesn't protect you from getting infected, is the other problem. So you can have it and you don't really make a good response that protects you. So
And I'm
it has
trying to
side
think of a way
effects.
to simplify that to tell parents.
I know. So it has fewer side effects. It does wane over time, which I think is a concept people are well familiar with now, the idea that a vaccine isn't always forever. And this vaccine gives you less protection over time, which is why you get boosters on it and tetanus, because they don't last forever. And so the fewer people who have ever gotten the vaccine or are up to date on it for their boosting means there are more people who can get it. And once somebody gets it, it's easy to pass it on. That's as close as I can do to short.
That's excellent on the spot. Thank you so much. All right, I'll just keep this open for another couple minutes for any other questions or comments that you have.
I guess I'll add to what Dr. Sato said. No vaccine prevents 100% of infections, but a really important thing that vaccines do is prevent severe illness. So it can keep people out of the hospital, which is super important, in addition to preventing infections, but preventing severe outcomes is also important.
Absolutely, good point. Want to keep people out of the hospital.
If you think about your child having a cough for 100 days or you having a cough for 100 days and having to be out of school for a couple of weeks, that's more than most colds. So maybe you don't want it.
Absolutely. And I just think about just how difficult it would be to have one of those coughs that just lasts such a long time because, you're not necessarily like super sick when you're coughing that entire time. So you wouldn't necessarily want to be at home, but at school, you'd be disruptive to class if you're coughing all the time. And the other students wouldn't appreciate that too much over time. So if there's any possible chance to avoid that, absolutely you would, because it's not good.
And like kids will recover except for the cough, so they'll be fine, and then they'll have an episode of coughing. But that can happen like during recess when they're trying to be up and around more. And so it can be really, or gym class, so it can be really hard on them because they can't participate in things they want to participate in.
Mm-hmm. All right. Well, good job, Linda. She said she went through the whole school a few weeks ago and changed out every air purifier filter. Good for you. That's going to help. All right. And thanks, Sue. She said, thanks for the presentation of resources. This is going to be helpful to share with staff. Awesome. All right. Well, I will just say, well, actually, I should turn it back to the panel and just say any last words from the panelists. Any last words of wisdom from ICAP or anybody else out there?
That's what you say. Thank you for all that you guys do. You guys are seeing this on the front lines right now. I can't imagine seeing all these kids every day and everyone's coughing and having to deal with it. So great work, guys.
Thank you.
Yeah, I was going to say exactly the same thing. Thank you for what you do. We just want to make sure your work is easier. So we want to provide all resources that we can to make sure that you have all the education available to the parents, to the students, to environmental cleaning. So please reach out if you need any resources. We're more than happy to work with you. Shameless plug, go to the ICAP website. We have our pathogens of interest, and you have pertussis on that list. We also have our school resources. We have the newsletter for school nurses. We want to reach out to you in every way that it's easy and works for you. So please feel free to reach out.
Thank you. Chris or Dr. Teran, do you want to put the ICAP phone number in the chat for anybody who would like to get in touch with you guys? All right, so if a school would like some help from ICAP, you can call during normal business hours at 402-559-2881, and you can get in touch with an infection preventionist in Nebraska who can help your school. So thank you. Or you can email nebraskaicap@nebraskamed.com. Easy enough. Thank you. Thank you. Very informative. I just wish it was easier to convince parents to stay up to date on vaccines. I think we all agree on that. Yes, 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 indeed. All right. Well, again, if you have any more questions, you can always email me, email ICAP. But just wonderful that everybody, school nurses and the panelists, were able to just come together on short notice, just because this is an important topic and we want to keep everybody aware of what's going on in Nebraska and that we are seeing increased numbers, and make sure that you school nurses get your questions answered so you can do the job of keeping the kids safe in school. So thanks everyone for being on here, and have a great week, and happy holidays. Thanks, everybody.